It does seem to be a bigger tick season than usual.
Dr. Stephen Rich leads the team at NUVEC, the New England Center of Excellence in Vector-Borne Diseases. It's funded by the CDC and centered at UMass Amherst, and they're working to reduce the risk of tick and mosquito-borne illnesses. A large focus of the team, eliminating ticks at the original source.
If you ask the question, why are there more ticks now than there were 10, 20, 30, 40 years ago? It's because there's more white-tailed deer. What we're trying to do is find things that you can literally feed to deer in much the same way that people do with their pets. Things that you can feed the deer that will then kill the ticks on the deer.
Late last year, Health and Human Services Secretary Robert F. Kennedy vowed to improve diagnostics and treatment of Lyme disease, infecting an estimated 5 to 7 million Americans over the past decade and causing chronic serious conditions if left untreated. Now there's new hope as a 4-shot and booster vaccine for Lyme gets closer to approval. But with Lyme just one of 24 tick-borne illnesses, Dr. Rich cautions it won't be a cure-all.
Even when we get to the point that we have a very effective vaccine, which may be on the horizon, it's not going to be the panacea. It's not going to cure the problem. We're still going to have to figure out how to protect against other tick-borne diseases and protect people that can't be vaccinated.
Now, Dr. Rich says even if you do end up getting the vaccine once it's available, it's really not an excuse to become complacent. So, as always, remove ticks just as quickly as you can. And once you do, keep it to test it for pathogen exposure.